Did reminders go out, Hannah?
Yeah, I emailed everybody in the advisory committee, and also I emailed the public on Monday.
Okay. But they knew about the date change before Monday, correct?
They should have gotten an email from when Sharice changed the Zoom invite.
Got it. Well, let's see what happens.
A lot of people said that they might come on later. Like I know a lot of people from the Lower Eastern Cherokee Nation said that they would be on later. I believe Chris Judge and Dr. Leader both said that they would be on at some point, so people might trickle in.
All right, who do we have on from the tribal community? I see Commissioner Sancho Baker. How are you?
I'm great. How are you doing?
Good. Good to see you on the call this evening.
Good to be here. Can you hear me?
Yes, ma'am.
Okay, great.
Looks like we've got Chief Mitchum and Chief Nelson.
All right, we'll wait a few more minutes and see who else joins us. We may need to, if they prefer evenings, we may need to look at 6:30 as opposed to 6 o'clock, because a lot of folks work until 5 or 5:30, and rushing to get home to get on the call could be an issue. Chief Nelson, what's going on good in your neck of the woods?
Hello, it's good to see you again.
You too.
Things are going well here. We've been in contact with a lot of our tribal people. They're happy that COVID is going away.
I can imagine.
And we're hoping the opportunity for us to be able to meet in person more often and meet with some of you down in Columbia.
Absolutely. Absolutely. I'm ready to see folks now, other than Zoom.
Yeah, I think we're going to get through this, and I think we're all blessed to be healthy.
Absolutely. Good to hear from you, sir.
Yes, ma'am. You too.
Chief Mitchum, I saw you on the call a few minutes ago. You're muted.
I'm here. How are you?
I'm good. How are you?
I'm doing well.
Good. I'm going to have to get out there to see your clinic to see what you've done since I came there last year.
Oh, it's beautiful.
Okay. Many people coming to the clinic?
There is.
Very good.
This is going really well.
Excellent. I'm glad to hear that. Well, we're going to go ahead and get started with whoever's on the call. And hopefully others will chime in, but this is our final meeting for this year, this fiscal year. which is the fourth quarter, we won't come back together again until probably September. But I wanted this meeting to hear from some of the tribal folks to see what we could add to our accountability report in the form of a strategy to help reach some of the goals that they have set for themselves. And that's why I wanted to see more chiefs on this call, because this is the last one for the fiscal year. Whatever is discussed on this call will be included in my accountability report that's turned over to the governor's office. Let's see. Jerry, why don't you go ahead, you and Hannah, just give some brief overview of some of the things that you all have done. One thing I've noticed this year, well, since COVID, we have connected to a lot of the tribal communities, and I think the relationship is growing and it's getting it's getting better. Folks are warming up to Jerry and Hannah, and they're getting out to the tribal areas, tribal lands to see where they are. And I think that's a good thing. And the more COVID leaves us, and hopefully Delta won't come into play very much in South Carolina, we'll be getting out more. And I'm hoping that our first meeting in September will be an in-person meeting. So that's the plan right now. And we'll start looking for a place to host it, just in case we still have to spread out some. So Jerry, why don't you just give a brief overview of some of the places you've visited over the last few months or what have you, and some of the things that have been going on while we're waiting for others to join the call.
Sure, Dr. DaCosta. Hello, everyone. As Dr. DaCosta was saying, me and Hannah have been on the road quite a bit since actually I came on board in February. A lot of road trips, field trips that were based upon the gracious invitation from the various leaders around the state. As I've said before, I never go where I'm not wanted. And so we've covered about 95% of the people we serve, I'd say, right, Hannah? Somewhere around there, more or less. We are still open to those invitations to go visit those. We haven't had an opportunity yet, so we're hoping we'll hear more, get more invitations so we can continue that work that Dr. DaCosta was alluding to of on-site. I am very much an in-person type person as well. I'm very social, as probably my coworkers can attest to. I do like to do things face-to-face if possible, and I'm looking forward to, if we can indeed have a face-to-face meeting in September. It helps build that camaraderie that I've tried to establish since I've come on board, and hopefully, fingers crossed, we can do that in September. We've been to Walhalla, we've been to Waccamaw, we've been to where are we all? Santee, we've, of course, Chief Mitchum, we visited you. Let's see, we've been to PD, trying not to forget anybody, but about 95% of everyone that we've served so far has been seen. And what's forthcoming, I'm going to be participating in a online training in August, a national forum on grant writing for Native American leaders and service providers that Dr. DaCosta has so graciously agreed to sponsor for me to participate. And hopefully we'll get some good information out of that, and how to, formulate grants and how to fine tune that process to where we can perhaps secure those for our service communities, or perhaps, establish training for our Native communities on how to actually do that themselves, and like self-empowerment. So I'm looking forward to the training in August. As an aside, it's part of what I'm doing. Most of you, well, the two chiefs who are here, I believe both of you have received our CMA Disability Services Guide. I believe Hannah sent those. I know Hannah sent those out to everybody. So you should have received one. If you didn't receive a Disability Services Guide, please let us know, and we'll be glad to send you another one. But I developed that for, first and foremost, for the Native peoples in the state, but also in a more expansive role for all of the minority communities that we do serve at CMA. And just to make the disabled members of those communities aware of the array of state services that are available to them that they may not have been aware of previously. Because like I've said before, you know, the daily struggles of just being a minority in itself, but if you're also a minority with a disability, you know, it's even tougher. It's tough for a lot of people, which it many times doesn't have to be, because there are services out there that can, you know, be provided to enhance capacity building, to enhance economic independence. And so long story short, in developing that, I, along with that, was able to develop some MOUs with other state agencies, such as the South Carolina Vocational Rehabilitation Department, or VR, as we call it in the field. My previous employer, the Commission for the Blind, DAODAS, which is, and this is a mouthful, Department of Alcohol and Other Drug Abuse Services. I think I got that right. DAODAS, and also ABLE South Carolina and Disability Rights South Carolina. So we have MOUs, working MOUs with all those organizations and agencies. And looking at some of the statistics we've been getting in on the minority populations that especially Voc Rehab and the Blind Commission serve, SCVRD, Voc Rehab, over 50% of their client base is in a minority group. However, the Native American population is very underrepresented there, very small percentage. So I still think a lot of outreach needs to be done by both, you know, CMA and Voc Rehab, and making the Native peoples aware of the services they offer, and also the Blind Commission. 60% of their client base is of a minority, or is a minority, but the Native percentage was very, very low as well. So there's still a lot of work left to be done, but you guys can help me and each other do this by distributing that service guide to your people and your networks, and especially like the chief mentioned, I know you're very much into health, obviously, and you know, through your health networks, local, around the state, making them aware that, you know, hey, just because you have a disability, you think you can't work or you can't be financially independent, that's not the case. Here's some resources that can put you on the right path and, you know, help with that. And that's, I guess, what's the phrase? The Reader's Digest version, an old phrase of what I've been doing. And Hannah, certainly, you know, go ahead and fill in what I may have forgotten.
We're also just working on like division compendium stuff. I think did we talk about that at the last meeting? I don't remember, but if not, we'll talk about it at this meeting. We're planning on releasing that at the next advisory committee meeting. So we're just making some final adjustments so that everyone will have like a complete guide to what we do as a program. And then I've been trying to, as I get them, send out as many resources as I can that are applicable to the Native American community. And I will continue to do that for the foreseeable future. So yeah.
All right, very good. Well, it looks like the crowd's slow, but still not coming in. Maybe we need to send another reminder. Sharice, can we send another reminder through Zoom telling folks we are on right now?
Yes, I can email them.
Because I really want them to hear from Dr. Fenton and Anthony Brockington. Hannah, let's talk about this needs assessment survey. Will you be talking about that, or who will be talking about the survey?
So mainly Jerry and Dr. Fenton are going to talk about that. So maybe we should have them introduce themselves first, and then Dr. Fenton can talk about the needs assessment survey a little bit.
Sure. Robert, go ahead and introduce yourself, and then Anthony will introduce himself, and then you can go into the needs assessment, you and Jerry.
Thank you, Dr. Acosta. Thank you, everybody, for being with us this afternoon. My name is Robert Fenton. I'm a sociologist by training. I'm the new Director of Research and Planning here at the Commission for Minority Affairs. Basically, you know, I have experience conducting my primary research with surveys. I've been mapping a lot of data lately, and looking forward to expanding a little bit upon that with the Native American communities in the state. But you know, I'm open for any suggestions as far as data needs, and then you can reach me through my email or call me through my office phone, and I'll be happy to get back with you with certain petitions. And I'll hand it over to Anthony for right now.
Okay, thank you, Dr. Fenton. When I first came on board, like I just spoke of reference to a few minutes ago about going around the state and meeting with the different leaders around the state. Part of that was just introduce myself, but also it was, I call them listening sessions. I had to sit down and listen to what the needs were of the various communities that we were serving. And in retrospect, I think I probably should have made that maybe a little bit more formal and maybe taken some notes or recorded so we'd have more data. It's in my head, but it's it's not recorded. So because that did not occur, I said, well, we need a more a true scientific basis on determining, finding out what exactly are the specific needs of the various communities around the state. And so the best way I thought of doing that was to develop a very simple one-page, with Dr. Fenton's help, needs assessment survey. And I believe, Chief Mitchum, did I hear that you did not receive one, or you have misplaced yours and need another one? You're muted, Chief Mitchum.
Correct. I did the needs assessment. I should be unmuted now.
Yes.
Okay. I did one in, I think, August. The one that came in, the more recent one, I have lost. I've
Oh, no
actually
problem.
lost.
Okay, no problem. We can send it through the mail. Yeah, we'd be glad to send you another one because we do want to hear from everybody.
And I do apologize for that, but apparently in all of the moving around, it's been misplaced.
Quite understandable, not a problem. So we'll be glad to send out another one. So like I said, we want to hear from everybody, your opinion, and we want to know what your needs are. Despite our visit, I have a good idea, but we have nothing on paper. So we definitely want to, have that in a format that Dr. Fenton can track and compile his data and so forth. So that went out to all of the advisory committee members and everyone that's on the email list, correct, Hannah? I think the needs assessment survey went out to everybody, okay? And we thank those who have returned them so far, and we're hopefully, fingers crossed, more people will return those, so Dr. Fenton will have a good sample to work with and, provide some data analysis to us. But so Dr. Fenton, now that they know, everyone understands the purpose behind the needs assessment survey, could you just go in and tell us what you know thus far based on what we do have, if you wouldn't mind?
Yeah, no problem, Jerry. So I spent part of the day analyzing the data that we did receive. I computed basically a rank order analysis of the 8 items that were up for that were basically asked to be ranked in order of importance. And based on the preliminary data that we have right now, education issues come first, followed by access to infrastructure and development, and then at third place, a lack of state or federal recognition, and then followed by health and mental health issues, employment, criminal justice, legal issues, environmental issues, number 6. Actually, criminal justice and legal issues and environmental issues were both tied at 6th place. And last on the list of importance was drug and alcohol abuse issues. So I think, bar some sort of unforeseen submission by those of you who haven't submitted yet, that list is probably not going to change too much. 1 or 2 of those items might move a place up or down, but I think we got a good idea so far of like what issues are most important to, at least according to the surveys that we received, most important to the tribal communities in the state. And then I think Jerry will be able to basically, organize his planning around what issues are most important at first. And then when we have a little bit more time, probably we'll be able to delve a little bit deeper and develop a little bit more around other issues that are of lesser importance, I would guess. So far, we don't have any tribal community that agrees that enough services are adequate and available. So I think every single tribal community is in agreement thus far that that there needs to be more services available to the tribal communities. About half of the tribes have affirmed that some services aren't available but should be. I don't think that's a surprise. And there's only one group so far that has stated that they're unsure of all the types of services that may or may not be available. And I think, you know, we probably should look a little bit deeper into that and see perhaps what services that aren't, as Jerry mentioned earlier, with services associated with disabilities and the population, Native Americans in the state that are actually receiving services from groups that are there to help with disabilities. Perhaps there are services that people just don't know about. The famous unknown unknowns are often the hardest thing to track down with data. But I think so far the data is pretty clear, at least on what are the most important issues for the tribal communities in the state. We'll wait for more surveys to come back and see if that changes. But I think that that's a, yeah. Do you need the whole entire list, Chief Mitchum?
We can email those things. We can email those issues because there are so many people who are not on the call today. We will do like a overview of the meeting and send it to the tribal community Friday or Monday, somewhere around there, so that they'll know what has been discussed and things of that nature. So you'll get that in writing, Chief Mitchum.
Yeah, I think the ultimate goal is to obviously publish like a little fact sheet that every group that participated, even those that didn't participate, could probably receive. And it would be at least a talking point between the CMA and the different tribal communities. And I think, yeah, that's kind of what we're just waiting for, a little bit more of the data saturation to come in so that we can finalize that and get it out. And I don't know if Jerry has anything else to say, but that's kind of what I prepared thus far.
Okay. All right. Anthony, why don't you go ahead and introduce yourself?
I don't know if Anthony's on the call.
Okay. All right.
But if Brenton, could you give an update on the General Assembly, like end of session update?
Yes. Yes, no problem. So let me share my screen. Give me one moment. Okay, so the General Assembly, they adjourned sine die back in May, and some of the major issues that they're dealing with, they have finalized the state budget, and so more information on that will be forthcoming. And they're also going to return in September to deal with redistricting as well. But some of the major issues that they dealt with this past legislative session for college athletes, beginning in July of 2022, the state's college athletes will be able to enter into contracts to receive payment for the use of their image, likeness, or name. However, they are not allowed to be paid for athletic performance, and they cannot take any contract that will interfere with their academic or athletic responsibilities. In regards to COVID-19, the General Assembly allocated approximately $200 million to combat the pandemic. That included money for PPE and also cleaning supplies for state agencies and school districts. Executions was a big item that was discussed. If you remember several years ago, South Carolina had the default method of lethal injection. However, there were companies that decided they did not want to have, the companies that made those injections did not want them to be used for death row. And so the state has now made the electric chair the default method of execution, and also as a secondary option, execution by firing squad. However, the judicial branch of the state has put executions on hold until the Department of Corrections comes out with a plan to offer firing squad as an option. Another hot topic was open carry. Beginning Sunday, August 15th, registered concealed weapons permit holders in the state may legally open carry. But once again, that does not take effect until Sunday, August 15th. and you must have a concealed weapons permit to be able to legally open carry in the state. When it comes to public education, the General Assembly reinstituted an annual salary increase for the state's public school teachers, and they also passed legislation allowing the state superintendent of education the power to remove the boards of chronically low-performing school districts. If I recall, I believe if you have a school district that performs poorly for 3 consecutive years, this legislation then kicks in, and the state superintendent of education has the power and the discretion to step in and remove those boards. And then just last thing, just as an event, myself and Rafael Ofendo Reyes, who's our Asian American and Pacific Islander Affairs Program Coordinator, we will be presenting the agency's Civic Engagement and Education Academy at Clemson University's 2021 Men of Color National Summit. So with that, I will stop sharing, and if there are no questions, if you have any questions or anything like that, I'll be sure to put my contact information in the chat box should you have any questions or need me to follow up with anything. Thank you.
And Brenton, it would be good if we had that summary of the legislative information to share with all program managers to get out to their advisory councils.
Yes, ma'am.
So that, and I think we'll do an end of year, it'll be like a legislative wrap up.
Yes, ma'am.
To all council members, advisory council members. Very good. Well, it looks like we're not going to be able to get into the scheduling and what have you, since we do not have enough tribal leaders on the call. We need a majority to deal with how we want to reshape this advisory council. So we're going to table that particular issue. And I think that we've covered everything else on the agenda, and anything else we'd have to go over that once we have our first meeting, probably in September. So in the meantime, Jerry and Hannah, if you all will compile a 1-page, no more than a 2-page, which will include a legislative update, and get it to all the tribal members, letting them know what we discussed today. And we can regroup. Hopefully in September, we will be able to have an in-person meeting, go back to our morning in-person meetings. I think folks are really zoomed out. I know that I am. Last week, I think I probably had 10 Zooms, and I'm zoomed out. So I'm ready to look at folks, and I'm ready to see Chief Nelson in person so that we can have our chat. And I think a lot of the other folks want to really, really sit down in person. So we're going to summarize the things that were discussed this evening. Oh, is that Chief Creel trying to come in? We will let him connect. Chief Nelson, any comments from you?
Well, I wanted to ask you one thing. First of all, I do appreciate you and your team for what you do for Native people in South Carolina. It's very much appreciated. And next, I want to point this out. We do not have a Native American museum in South Carolina. We've got museums in the counties, state museums, African American museum, but we do not have a Native American museum. I know you had a lot of influence in South Carolina. And, you know, I know this is probably a project that would take years to get going.
But it needs to get started.
But let's get it started. And I want to bring that up. I've mentioned it to other Native American people. They're in full support of it. I've mentioned it to other archaeologists and other important people in South Carolina. And I wanted to bring it, since this is on record, let's start somehow to get legislators to support it, the people of South Carolina to support it. And let's build a Native American museum in South Carolina, if it takes 2 years or 5 years, whatever. But I'd like to see it done for all the people that's been here for thousands and thousands of years. Let's do it for them and do it for us now.
Absolutely. Hannah, if we can put that down as, Brenton, as a legislative request, because that would be something that we would approach the General Assembly about, asking them to consider legislation, because you're absolutely right. Have you been to the museum in Washington, D.C.?
I have not. I plan on going there soon.
It is,
I'm looking
yeah.
forward to being there. But I know we probably could never achieve anything half that size in South Carolina, but whatever we can get, I think it would be important to the native people of this state. And so if we can get that going now with your support and other people's support, I think we can get it done.
Absolutely. We will definitely put that as one of the priorities and get it before the General Assembly. And once we get it in front of the General Assembly, maybe form a committee of chiefs to go there and state your case, your position, and move from there. You have to make noise. You have to make them aware that you want to be recognized in whatever way. And a museum, I think, is very much needed. And we will definitely put that on our list of priorities for the next legislative year.
Absolutely.
So we will do that, and we will definitely come back together to talk with the other chiefs about how we're going to proceed. So let us get some guidance on how we would approach this and bring it before the General Assembly. You have to start somewhere, and you're right. No better time like today to start
Absolutely.
looking into these kinds of things. I'm all for it.
Well,
I
thank you. Thank you very much. I appreciate your support. And I think we can get it done if we work hard at it.
Absolutely, I agree. Chief Creel, good to see you. What's going on down there in Edisto? You're on mute. Your TV's muted.
How about now?
Now I can hear you.
Lots of irons in the fire, just waiting on loose ends to come together.
Very good. Very
Working
good.
with land acquisition and letters of support for recognition, continuing to work on our petition, updating our family folders,
Very
updating
good.
state petition, etc. Yeah.
And didn't Senator Scott's office came out to see you?
Yes, we did have a visit with Mr. Jenkins and
Alyssa.
Alyssa came out, and we met and discussed some issues and things that were some avenues that we're going to take in regards to getting letters of support and so forth.
Very good. Very good.
Also reached out to Clyburn's office, the Biden's administration, and to Lindsey Graham, but we're waiting for, response.
Sure. Very good. Well, if we can help make some contacts for you. One thing I do know, and that's that congressional bunch. I spent 20 years with them, and I do know how to reach out to them and their key staffers. So just let us know what else we can do to help move the needle. I think that the congressional, using the congressional methods to get federal recognition is the route to go.
Yes.
It moves much faster than the bureaus.
Yeah.
The bureau's path could take 10, 15 years.
That's correct.
So if we can help in any way to expedite this process so that you can get your recognition, that would be great. I'd like to see a couple of federal tribes in South Carolina. So it's going to take us fighting, scratching, yelling, screaming at a whole politicians telling them, we need this done.
Yes.
And so we will work closely with them to try and see what else they need to do, because a lot of them have never really been presented with this in South Carolina. So we're sort of following the lead of Virginia and some of the other states who've actually done this before through congressional means. Very good. Chief Crummy, is that you hiding behind the camera?
Can you hear me?
I can hear you. What, you don't want me to see you?
See me?
I can't see your face.
Yeah, well, I don't know how to make it where you can see my face.
Oh, your camera's turned off.
That's what it is.
Yes, sir.
Mhm.
If you click that little camera thing, it should. There
That
you
one?
are. See? How are you?
Doing great. You're
Good. Tell me what's going on where you are.
not a whole lot. Not a whole lot because just a lot. We got a lot going on, but I got vice chiefs. I got people working on different things, but myself, I'm doing nothing except for working for myself.
What kind of work do you do?
I build schools.
You do?
Do.
Very good. Very good. So you're a contractor?
I work for a contractor.
Okay. Very
One of the
good.
largest contractors in the state. So actually, they're in Columbia.
Is it Hill?
No, it's called MB Con Construction.
Oh, yeah. I know MBCon. Right. Okay.
That's
Okay.
right.
Very good.
I'm actually in my apartment in Bluffton, South Carolina right now, where I spend more time than home.
Wow.
So, yeah, it's kind of hard to do anything for the tribe being away.
You're right. But you have a good group of people holding it down.
I do.
Tell me what CMA can do for you. This is our last meeting for this quarter, for this fiscal year. We won't come back until September. And we've covered several things before you all came on, and we're going to summarize them and email it to everybody instead of trying to go back through it. But in the meantime, what can we do for you, Commission?
CMA can help me get my 501c straight that I've been
Okay.
asking for quite a while.
Maybe we need to close that and start new.
Whatever.
It's really hard to going to the IRS to try and reopen a 501 that they shut down. It's difficult. It's easier to submit another application and start new. And I don't. What's the name of your 501c3?
Say it again.
What's the name of your 501c3?
What it's under?
Mm-hmm.
The Santee Indian Organization.
All right, we may need to add something different, or we can use that same name and put doing business as or something like that to get you a new 501c3. I think it's going to be more difficult for the IRS.
Well, I had Buster Hatchett. He's been helping me.
Uh-huh.
And it seemed like we got other folks that's got their name tied up in the Santee Indian 501c, and that's
okay, and that's going to cause some problems for you. Why don't we start from scratch? Let's start from scratch, and you may have to, and you could still, are you in the state, you're classified as Santee?
Yeah.
Okay, so we're gonna have to add something to that to give it a slightly different name so that when we apply this time, all that other old stuff that's holding it up won't be added to it. So Hannah, would you look into that for me to see how we can reclassify, and let's just start from scratch. Because when you have a lot of people tying into your tribe, it's going to slow the process up across the board. And,
Go ahead.
And that's probably what the holdup is right now, what the Chief Hatcher is finding out.
Yeah. Well, like I said, the last time we met, I think we was at Catawba.
Uh-huh.
And the reason why I quit coming to the CMA is I don't need somebody to tell me what I can do. I need somebody to help me.
Right.
So with Hannah or whoever, I need somebody to open the doors and then help fix it for me.
I got you. We're going to do that. We're going to open that door, and we're going to fix it so that you can move forward. It is that 501c3 that's going to open that door for us to help you get funding.
That's what I mean.
You can't get grants without a 501c3 that's in good standing. So therefore, we're going to start from scratch. That's going to be Hannah's project to upload the information. We're going to have to do a reclass in the state as far as, and we would change to the name that you have now, and you're probably going to have to put doing business as the Santee such and such. That's going to pull you away from that old file. Open a new file, and we can go from there. How about that?
That would be great.
And we're going to work on that now. We're going to work on that over the next week or so. We're going to get that started so that by the time we meet in September, you'll have your new 501c3.
That'd be great.
That's the easiest way for us to handle that. It's just too difficult trying to dig into an old 501c3. Okay, so that's our task for you and the Santee. We got you.
Sounds great. Thanks.
All right. Chris Judge, how's everything going at USC Lancaster?
Hey, Dr. DaCosta. Hey, everybody. Things are going good. We're hoping to open back up in August full time. We're now open by appointment. If anybody wants to come, just set an appointment and we'd be glad to have you. We have some sad news. Dr. Brooke Bauer has been cherry picked by the University of Tennessee at Knoxville and will be leaving us.
Oh my goodness.
Our only Native American faculty member.
Oh my goodness.
Further, Courtney Lewis at USC Columbia has been cherry picked by Duke. She will go up there in August of 2022. So we have lost both of our native scholars at USC.
Oh my goodness.
Yeah.
That's a tough one. Wow. Well, you heard Chief Nelson talking about the Native American Museum.
I was glad he didn't mention my name, but I'll be glad to help him.
Exactly. That's what we're going. That's why I'm saying it to you, because I think between you and CMA, I think we could at least get the conversation started. And that's how you have to move, by getting the conversation going, getting the interest of the legislators, and moving then towards how we're going to shape this, what kind of strategy we'll use to make this happen over the next few years. But the thing is to get the conversation going first.
Absolutely. And my friend Chief Nelson has mentioned this project to me several times recently, and I want to help him do it. I think it is a good idea. He's right. We've got museums for other groups, and
absolutely.
And we've got plenty of things to display and educate the state of South Carolina about these folks. So
absolutely,
I will happily help anybody, the commission or Chief Nelson, whoever, get this done. And you're right. We got to convince the folks down there in the big house on Gervais Street in Columbia to give us the money to do this and help us out.
Absolutely. So those are two big priorities we've got right there: starting the conversation for the museum and making sure that the Santee get their active 501c3. Oh, and third, we want to make sure we keep the fire lit for Chief Creel's initiatives. We are definitely on top of that, and we're going to try to do our best to get some closure to some of these things this incoming year.
Hey, Chris. Chris.
Go ahead.
Yeah, I wanted to tell Chris, he and I have talked about this many, many times. There's millions of artifacts that's sitting around in warehouses in South Carolina, and nobody can see those artifacts. And even the Institute and other places have nowhere to store this stuff today. So why not build this gigantic, beautiful Native American museum and put them there?
I agree. I agree. And
sounds like a good.
That's a great initiative that we need to definitely focus on this coming legislative year, the incoming legislative year. We cannot keep waiting and delaying and delaying. We have to live for today, because tomorrow is never promised. So therefore, we're going to take on that challenge and keep moving.
Another advocate for this project would be Dr. Adam King. Dr. Adam King was named today as the director of the Institute of Archaeology and Anthropology. So
Really?
the institute has
Okay.
the institute has a new director as of today. He is a very well-known scholar in the Native American archaeology in the Southeast, and Lamar, we need to put him on that team too.
Absolutely. We need to set up a meeting to discuss a game plan on how we're going to get this museum, and he would be instrumental in helping us to shape this. So that's a plus. I think that's a good route to start.
Yeah, I'm coming down to Columbia tomorrow, Chris. I'll go by, and if he's at the Institute, I'll go by and say hello to him.
Okay, come look me up too.
All right, I'll do that.
Very good. Any other comments? We've gone a lot through some things that we discussed earlier, but because we only have a small amount of folks, some of the main things like creating committees and other things that we need the entire group to sort of vote on or what have you is limiting us. So we're going to have to table some things. But one thing I do want is for Jerry, for those who came on after you presented, if you can just give another brief overview, just 2 minutes or so, letting them know where you are, some of the things that you've done since you've come on as the Native American program manager.
Yeah, sure, Dr. Acosta, be glad to. Again, a synopsis of what I shared with the others earlier. I came on in February of this year, and coming on board, I saw where there was a need to reestablish the working relationship with everybody in the state, it seemed. And so me and Hannah then set forth and made lots of road trips, field trips, whatever you like to call them, to the communities we were invited to sit down and listen to you and to hear your story, different leaders, and tell them what your communities are needing, what you've accomplished. Again, we've visited about 95% of everybody. Still have a few out there that I still would like to see, and awaiting invitation. If the invitation is sent, we'll be glad to get back on the road and go to those places. I have a training coming up in August, online webinar on specifically on a Native American grants forum, and hopefully a lot of good information will come out of that in helping us at CMA help the advisory council members either securing grants or awarding grants, and fine tuning the grants process. And this is specifically for Native Americans, so I'm looking forward to participating in that in August. And the last major thing I pretty much mentioned was we talked about the disabled members of your respective communities, and many times that they're not aware of all the various state resources available to them in the state that can enhance their independence, enhance their employment, their employability. And I've been able to secure MOUs with sister state agencies such as the South Carolina Voc Rehab Department, Commission for the Blind, Department of Alcohol and Drug Abuse and Other Services, ABLE South Carolina, Disability Rights South Carolina. And I put all of their information into what I call a disability resource services guide that everybody should have received at this point. But again, if you had not received one, let me or Hannah know, and we'll be glad to get one to you guys. So you can therefore then distribute it to your members. And that's where I'm counting on you to get the word out to your respective communities. So we can send you the guide, but please, share that with your community members so that they are aware that they themselves have a disabling condition, or if they have a family member who has a disabling condition. And if you want to know more about those organizations and not bother reading, through their resource guide, I have a very strong background in disability services. I'll be glad to explain the different agencies and the programs to you. If you want to have a chat over the phone or what have you, be glad to help you.
All right, thank you so much. And before we end, I wanted Chief Mitchum just to give some highlights on some of the great things she's doing in Nices with her health center down there. Chief Mitchum, you want to just give them an overview of what's going on down there?
Sure. We recently, this past month, over the past month, we filed a HRSA grant for vaccine outreach. And the way we wrote the grant is that if we are selected in the grant award, we will give each tribe in the state $30,000 to promote the vaccine. We have not heard yet about the grant, so we'll keep everybody updated. We are starting health programs in areas, hopefully in the next couple of weeks. We're waiting on the PD to tell us when they're ready to start theirs. We are working with Urban Indian Health Institute and Minority Affairs to develop the Native American Health Profile. Programs that we got going so far, the diabetes prevention program, the blood pressure self-monitoring program, Teen Talk, tobacco cessation, and we are starting a cancer program. In addition to all these wonderful things, Chris and I both are working on an issue regarding Westinghouse in the Fort Jackson Hopkins area. And that just about wraps it up. The most important of those is and linking all of us through Minority Affairs with Urban Indian Health, which puts us in front of IHS.
Okay, very good. Chief Creel, are you the only one with the full service health services down there?
I think so. I wanted to comment that we do have our clinic open on Tuesdays, Wednesdays, and Thursdays from 8 to 5. It's family medicine. We do Best Chance Network for women's health and cancer prevention, screening, and so forth. And we help get funding in the event there was a cancer found until cured, or until hospice services would be needed, and so forth. Also, we have a relationship with Elms Digestive. They help us with screening for colon cancer and so forth. There are appointments. We're appointment only, and we are open. We've seen patients from other states actually that come to the area that have no insurance, visiting families and communities. So we're open to all the tribes. If anybody
on the call, but Corey's coming early in the morning.
that are underinsured or uninsured, we help take care of those type patients.
Very good. I've been out there to see your facility, and did you?
Dr. Creel, are you open to telehealth?
No telehealth at this point, but we're in the process of implementing it at my rural health clinic in Walterboro. And once we sort of get the idea of how that's going to work, then hopefully we'll be able to do that with the free clinic as well.
Very good. Very good. Healthcare is critical. It is just critical, and we just don't have enough of them in our tribal communities. And those are some of the things that we want to help focus on. And that's why I'm glad that Jerry's looking at dealing with grants so that we can try and apply for more funding, because it is critical to have these services in the communities. And the only way we're going to get it is to try and raise the money ourselves most of the time. That means going after HRSA grant or anyone who's offering any kind of healthcare grants. And so my folks are training and getting up to speed on how they can best serve you by helping with grant writing if we need to, or even some research to find out what's new, what's out there. And because sometimes you can find grants for healthcare in some of the most unusual places, but it takes time to research for healthcare grants. So this is something that we're going to be looking into also in the upcoming year. We're putting all this together, and you all will get a list of it. And if you have anything to add to the list of initiatives, just add them, and we will put it in front of us as our 2021-22 health initiative going into the next fiscal year.
Excellent.
All right. Any other
Dr. DaCosta, one of the things that I would
go ahead.
One of the things that I would add to that, dovetailing off what you're saying, we're interested in seeing Minority Affairs create legislation to push through the General Assembly to create an Indian health fund for healthcare.
All right, now we'll see if if the General Assembly, or if we can create a health fund, and you get more money if you can get the federal government to fund it. So we can look at a couple of different ways to see how you would fund Indian healthcare. So we'll take a look at that and put it all out there, bring it back to the group and get feedback from all of you so that we're looking for money in all the places, even under the rocks. We will try to find money anywhere we can. So that's definitely a possibility. So Hannah's writing it down as we're speaking, so we'll be having another conversation and a lot to talk about in our September meeting if we don't meet before. I think I had a couple of my staff who are interested in doing a consolidated meeting among all 4 of our advisory committees. And I think that's a good way for each of you to get to know each other a little better, to see what you all do in your particular areas. So we're looking at doing that prior to the September quarterly meeting. So you'll be hearing from us over the next few weeks. And I'm hoping that we can do it in person so that folks can see each other face to face. So be on the lookout for an email with more information about that. Let's see, is the commissioner still on? Commissioner Sancho Baker, any closing words?
Good evening. Yes, I'm just glad I was able to make it to this meeting, and I'm sorry it's the first one and it happens to be also the last of the fiscal year, but I will hopefully be present at more of these meetings. And I'm always here to assist in any way. I'm happy with advance notice to visit any of the areas within the state. So just please feel free to reach out to me at any time through Dr. DaCosta or Hannah or Jerry, and I'm happy to help any way I can.
All right, thank you so much. Well, this is our last meeting for the quarter of this year. And it has been a good year. It's been a trying year. COVID has changed all of our lives for good, but we survived it. We're here. We're bouncing back. Now we need to keep pressing forward so that we can help to improve the lives of our families and those in our communities, one day at a time. I thank you all for all that you've done and for working so closely with the commission. I look forward to that relationship being strengthened as we move forward over the next fiscal year. And with that, if there are no other comments, I will say good evening.
Thank you. Evening.
Thank you.
All right, everybody.
Bye-bye.